The illicit drug supply has changed. We've seen the shift from heroin to fentanyl. Now it's being contaminated by a highly dangerous new additive. It's called xylazine, commonly known as tranq. It is a veterinary tranquilizer not approved for human use. When introduced to the human body, it causes a deep, unresponsive state of sedation and triggers severe, necrotic skin ulcers. To navigate this environment, we need to update our approach. This video is a practical, step-by-step checklist for adapting harm reduction strategies to safely handle xylazine. With a dose of naloxone, clean supplies, a phone, and this specific knowledge, you have exactly what it takes to save a life today. Step 1 is understanding the chemical we are dealing with. Xylazine is a non-opioid animal tranquilizer. It is intentionally mixed into fentanyl to artificially extend the drug's effects. This chart shows the average purity of xylazine and fentanyl in street opioid samples in Philadelphia. Look at the yellow line. By the fourth quarter of 2022, the concentration of xylazine climbed past 30%, demonstrating a rapid saturation of the local drug supply. This translates directly to extreme physical symptoms. Users experience heavy, zombie-like sedation and a dangerously decreased heart rate. It also triggers the outbreak of rotting, necrotic skin wounds, regardless of whether the drug is injected, smoked, or snorted. Because of this total market saturation, responders and users must operate under the assumption that every street opioid currently contains xylazine. Step 2 covers the modified overdose response. Right now, the primary point of failure for modern responders is panic. They administer a reversal drug, the victim doesn't wake up, and the responder assumes the attempt failed. Here is the pharmacology. Naloxone successfully clears the opioid receptors in the lungs, restoring the body's ability to breathe. But it has absolutely no effect on the heavy sedation caused by the xylazine. The brain remains locked in a dark, sedated state. Despite this, the immediate action required remains the same. If you suspect an overdose, administer naloxone immediately without hesitation. The diagnostic shift is in how you evaluate the patient afterward. Do not shout or shake the victim expecting them to wake up. Instead, lean in and look for normal chest rise and fall. If they are breathing steadily but remain asleep, stop. Do not administer endless consecutive doses of naloxone. It will not wake them up, and you will rapidly burn through your supply. Move into the post-reversal holding pattern. Place the person in the recovery position on their side, clear their airway, provide rescue breathing if needed, and wait right by their side. In the era of tranq, a successful overdose response is measured strictly by the restoration of oxygen, not by waking the person up. Step 3 is a strict 4-part pre-use checklist designed to prevent fatal isolation and blood-borne infections. First, confirm exactly what chemicals are present before any consumption. Use testing supplies like fentanyl test strips to understand your specific supply. Second, if injecting, use a brand new sterile syringe for every single dose. Reusing or sharing equipment transmits immediate infection. Third, follow specific cleaning protocols based on your route of administration. Use alcohol swabs to clean the skin prior to injection. If sniffing or snorting, flush the nasal passages with sterile water or saline before and after. Fourth, establish remote supervision. Use dedicated hotlines or digital apps to stay on the line with someone who can trigger an emergency response if you become unresponsive alone. Rigorously executing this 4-step checklist before every use drastically reduces the dual threats of fatal isolation and systemic infection. Step 4 addresses the most visible physical consequence of xylazine exposure, the development of severe, necrotic skin ulcers that frequently lead to amputation. The absolute first rule of prevention is location. Never inject directly into or around an existing wound. Proper wound care requires a sterile environment, which is difficult without running water. The practical workaround is to use hand sanitizer and sterile gloves to clean your hands before touching any broken skin. Execute a daily maintenance routine. Clean the wound strictly with sterile saline, apply fresh protective ointment, and wrap it securely in clean gauze. Watch closely for red flag symptoms. Active pus, spreading redness, sudden fever, or chills are signs of a systemic infection. At that point, immediate emergency medical care is required. Proactive, non-judgmental daily hygiene is the only effective barrier preventing a minor skin ulcer from deteriorating into a life-altering amputation. We have a clear framework. You're not helpless. You now possess the exact knowledge needed to handle xylazine on the streets. It requires two critical operational shifts. Know that naloxone restores breathing but not consciousness, and recognize that rigorous wound care is non-negotiable. Here are the specific contact points to secure supplies and remote supervision. Pause the video and screenshot this list. The Never Use Alone hotline is 800-484-3731. You can find sterile supplies through resources like Philly Naloxone and NextDistro. The drug supply is more lethal than it has ever been. By treating people with dignity and rigorously applying this exact checklist, we will keep communities alive.